Okay, guys, welcome back. Thank you so much for joining us. We're halfway through our final day of Bloom 2020, so make sure you get those comments in. We are making sure to grab all of them for the giveaways that you will be receiving next week, along with your swag bags. Like I've mentioned a couple of times, we did give some of our presenters the opportunity or option to record their session, and so Sanova Dermatology decided to do that. So with that being said, I'm going to go ahead and start their video. It is about 28 minutes. So if you need to go to the bathroom, grab a bite to eat, you can do that as well. And, just take your computer with you or your phone, however you're joining us. All right. Thank you so much.
Hi, Austin moms. My name is Jennifer Vickers. I'm a dermatologist and dermatopathologist with Sanova Dermatology at Bee Cave. I wanted to tell you guys a little bit more about myself. I'm a mom. I have 2 little girls. My oldest is turning 3 in October and my youngest is 7 months, so we are a little bit busy. I wanted to tell you guys about my training as well. I completed my bachelor's in psychology with the University of Texas at Austin, so go Longhorns. And then I moved to Galveston, where I completed medical school training in my intern year with the University of Texas Medical Branch in Galveston. I then went on to Manhattan, where I completed my dermatology residency with New York Medical College and my dermatopathology fellowship with Einstein College of Medicine in the Bronx. I moved back to Austin about 6 years ago. I started off in academics. I was teaching residents with a medical school and then transitioned into private practice, where I ended up with Sanova, so here I am. And today we are going to talk a little bit about skin issues that affect pregnant women, postpartum women, moms, babies, kids of all ages. So I'm really looking forward to it. Let's talk about one of the most common skin changes that I see with pregnancy. There are a lot of them, but one of the most common ones that I get asked about is something called melasma. Melasma usually pops up on the face, mostly on the forehead and the cheeks, although it can also be along the jaw, on the neck, and on the forearms as well. Melasma is kind of a brown discoloration. It's usually reticulated or somewhat patchy, and there are a few things that drive it. One of those things is UV exposure. We're finding out actually that heat can bring it out beyond just sun, and then of course hormones. And so I see it sometimes with starting a birth control, definitely with pregnancy, even sometimes when women start menopause. So pregnancy tends to bring it out pretty strongly, and it can be very frustrating because the things that we use to treat melasma, typically, we aren't really able to use safely in pregnancy. So you can't really use the treatments that work that well. There are a few over-the-counter things that you can use, however, and you can talk to your dermatologist about some of those. But a more common thing that you can do is just make sure that you're wearing sunscreen pretty strictly. I would recommend mineral sunscreens or physical sunscreens with zinc and titanium, because they do not generate any heat on the skin. And like I said, you do want to avoid heat, although that's almost impossible in Texas. So sunscreen very strictly, make sure that it's 30 SPF or higher. I would recommend a mineral sunscreen. And then also just making sure that you're staying out of the sun and staying protected with hats, staying under the shade, and like I said, staying out of the heat if you can. Once you deliver, you obviously can go back to using some things that work a little bit better. But in the meantime, I would recommend just sticking with things that are very safe and talking to your dermatologist about things that you can do. There are a couple more changes that I want to mention that you may see come up with pregnancy. One of those changes may be changes in your moles. So you may see that your moles get darker, they get bigger, they get more raised. This can be very normal in pregnancy. The hormones that our body is producing do tend to cause those changes to happen. However, I would still recommend that you really pay attention to your moles, see if you are noticing any changes in them, and then of course your dermatologist, so that you can be evaluated and your dermatologist can tell you whether or not those changes are okay. The other thing you might notice is increased itching. A lot of pregnant women have itching in their skin, and that's just part of pregnancy. Sometimes it can be due to dry skin, sometimes it can be due to eczema, and sometimes it's just there. So in that case, I'd recommend moisturizing your skin really well, staying hydrated, drink your water. But one thing to keep in mind is if you do have very severe refractory itch that doesn't really seem to be responding to anything, you may want to see your primary care doctor or your OB-GYN to be evaluated for elevated bile salts. That can happen with an underlying disorder that we do see with pregnancy, and it can be rather dangerous. So if you are noticing severe increased refractory itch, make sure that you do get it checked out if you have any concerns. And then of course, I always get asked, how can I avoid stretch marks? How can I prevent stretch marks? So that's the question that I get in pregnancy. And then after pregnancy, I get, how do I treat stretch marks, which we'll talk about a little bit later. In terms of avoiding stretch marks, it's pretty hard to do. You know, some women, they moisturize the whole time. They use very expensive products. They're very consistent with it and they don't get any stretch marks. And some women do the exact same thing and they still do. A lot of it is genetics. A lot of it is just what your skin does and how it responds. But really, there's not a whole lot that you can do. There's no harm in moisturizing. Like I said, that will help with the itch anyway. So if you wanted to try that, that could be one thing that you could do to maybe reduce stretch marks or possibly prevent it. But at the end of the day, it really is just something that happens, and it can be sometimes hard to deal with, but that's just part of what happens when we're pregnant, and we just sort of, you know, have to accept it as our warrior marks. So let's talk a little bit about postpartum skin. Probably the thing that I get asked about the most from postpartum mamas is what to do about stretch marks. So in pregnancy, I get asked how to prevent stretch marks. In the postpartum period, I get asked how to treat stretch marks. And unfortunately, my answer is much the same. So there are things that we can do to reduce the appearance of stretch marks, to minimize the appearance of stretch marks, but there's very little that we can do as dermatologists to completely eradicate them. It's sort of like a scar. So just like a scar, we can make it look a little bit better, but we really can't make it go away entirely. Some of the things that you can do would be to use a retinoid, a topical retinoid, for example, to help fade the stretch marks a little more quickly. So if they're kind of violaceous, if they're purple in color, they can fade to white a little more quickly if you do something like a topical retinoid. You can also do some laser treatments, whether that be resurfacing or even vascular lasers, to help sort of reduce the appearance. Another thing that you could do is microneedling. So microneedling is a treatment that we do where we use a motorized pen that has very tiny needles, roughly the size of like an acupuncture needle. And we do a controlled injury to the skin so it sort of builds itself from the inside out. So it builds collagen and it sort of heals itself from the inside out. And so it can help with texture changes and it can minimize the appearance of those stretch marks. One other common question that I get in the postpartum period is regarding C-section scars. So my mamas who have had C-sections want to know how can they improve the appearance of the scar, and sometimes they can be symptomatic. They can cause a little bit of discomfort, either pain or itching. And the first thing I want to tell patients is that a new scar is a scary scar. So right after you have the surgery, it's going to look scary to you, even when it is healing perfectly well. So if you will just give that scar time, oftentimes it'll look completely different in 6 months than it does directly after the surgery. But let's say maybe you want to be proactive, or maybe it's been 6 months and you still want to improve the appearance. My answer in terms of treatment is much the same as it is for stretch marks. So you could do something like microneedling to help reduce the color, to flatten it out, to help with texture, to soften it up. You could do a vascular laser to help flatten it out, to help with discoloration. You could do something as simple as silicone sheets, which you can get over the counter in a lot of drugstores, or oftentimes a dermatologist's office will carry a medical grade silicone sheet or a silicone gel that you can use for treatment. Let's take the conversation away from us mamas and direct it more towards our babies. Let's talk about newborn skin. So newborns have all sorts of rashes. They have all sorts of things going on with their skin. And most of the time, it's just normal stuff that we have to let them grow out of. The most common thing that I get asked about is probably baby acne. So a lot of babies, including my own, my 7-month-old, when she was born, had really bad baby acne, and her daddy used to kind of tease her about it, even though she didn't know it. So what can you do about baby acne? I think it's probably more distressing to mamas than anything else. They aren't sure what it is, and it can look bad. It can be moderate to severe, and it's your baby and you want to know what's going on. But oftentimes we really just need to let them grow out of it. There are a few things that we could use that help, like if you wanted to do something like a benzoyl peroxide wash, but you want to make sure that you keep it a low strength and keep it gentle. There are some other things that a dermatologist could recommend, but I would recommend seeing your dermatologist for that if you do decide to treat, to make sure that you are using the correct things. But overall, really, they just need to grow out of it. You can help them keep their face clean. That can go a long way. Just making sure that you're wiping dirt and sweat and yeast and all the things that tend to build up on our skin. The other thing I get asked about a lot with newborns is sunscreen. Can I use sunscreen on my newborn? If you look on the back of sunscreen labels on their bottles and their boxes, oftentimes they'll say that you can't use sunscreen until the baby is at least 6 months. And while that is mostly true, what I usually tell patients is that really you want to be keeping a baby that little out of the sun. So we do recommend that you don't use sunscreen because we want you to actually be keeping the baby out of the sun instead of relying on the sunscreen to do the job. If you do absolutely need to use sunscreen, it is okay, but I would recommend using a mineral sunscreen, something that only has zinc or titanium. Here's a little secret. I did use sunscreen on my babies. But I did try to do it sparingly, and I did try to keep them out of the sun instead of relying on that sunscreen. So what about toddler skin? Well, let me start by saying that a lot of the skin conditions that we see in kids span many of these age categories. And the one that I'm about to talk about is no exception. In fact, it's a really good example of that. And that is atopic dermatitis, which is a type of eczema. It usually shows up in early childhood, oftentimes infancy or toddlerhood, and it looks a little bit different in infants than it does in toddlers and beyond. So in infants, we see it oftentimes come up on the cheeks. It can be on the extensor surfaces like the elbows, places where the baby can kind of rub to scratch. So, this condition consists of red, scaly, itchy patches and plaques, and it can vary in degree. It can be very mild or it can be very severe. And oftentimes these babies will sort of rub on things to try to get rid of that itch. As they become more mobile, it tends to move to more like the flexor areas, such as the crooks of the elbow and the backs of the knees, the neck. But it can be just about anywhere, and it can move around. The thing about atopic dermatitis is there really isn't anything that we can do to completely get rid of it. Oftentimes, kids just have to outgrow it, and it will get better as they get older, oftentimes disappearing around the time that they hit puberty and beyond. But there are things that we can do to treat it to make children feel better, and that is topical steroids and other topical anti-inflammatories to help calm that down. Things that you can do at home would be just to moisturize really well. So using a nice thick bland emollient such as CeraVe or Cetaphil, Eucerin, Aveeno, Vanicream is another one that I like. Or you can use plain Vaseline or Aquaphor. And you put that on the skin rather frequently so that you are repairing that baby or toddler's barrier. That can go a long way in preventing and treating atopic dermatitis. But oftentimes, as I said, we do just kind of have to wait for the kiddo to get older so it starts to calm itself down. It can be rather frustrating. It does disrupt sleep because kids are itchy, they're scratching, they can get infections on top of that because they are scratching. If you have any concerns at all, of course, go see your dermatologist and they can recommend some treatments. What about skin conditions in elementary age kids? One of the most common ones that I get asked about is something called molluscum contagiosum. So that shows up as these tiny little skin-colored bumps, and sometimes they have a dell in their center, and they can show up just about anywhere. Kids who have atopic dermatitis or eczema, like what we discussed with toddlers, tend to get this a little bit more frequently. That's because the barrier of their skin is compromised, and so the virus that causes molluscum contagiosum can get into the skin a little more easily and create an infection. It is not dangerous. It is contagious, just like the name sounds, and kids oftentimes will give it to each other back and forth. So siblings will have it, or cousins will have it, or somebody in a classroom will have it, and other kids will have it as well. It oftentimes goes away on its own, but it can take a while, up to a year or more. And so a lot of families understandably want to go ahead and get that treated. So I get a lot of referrals from primary care doctors or pediatricians who send kids my way to do the treatments. And we can go about it a couple different ways. One way is to actually destroy the areas where the virus is living, and other ways can be to irritate the area or even just remove the center of the bump where the virus lives. Your dermatologist can talk to you about different ways of doing that. But the most important thing to remember is it's not dangerous, it is contagious, it can spread on the same kiddo or to another kiddo, so oftentimes it is a good idea to get it treated before it gets out of control. So I'm going to lump together conditions that we see in middle schoolers and high schoolers because they often are the same. And I want to talk about two different things. The first thing is acne. That is probably the most common condition that I see in my teenage patients, or at least what they come to me for. So in teenagers, they commonly have what's called comedonal acne, which is the type that has more whiteheads and blackheads. Well, they certainly can have all types of acne. And the most common place that I see it is on the forehead. That can be because that's just where it likes to be. And it can also be because they're wearing football helmets or baseball caps or other things on their forehead, even their hair, that can keep in dirt and sweat and cause friction. And all of those things contribute to acne. So there are lots of treatments that we can use, and they vary from being something as simple as a wash all the way up to something called isotretinoin or Accutane. And usually I'll bring in my patients and have a frank discussion with them about the severity of their acne and what their type of acne responds best to. And of course, we always take into account what the patient and their family are most comfortable with. So they can have it on the chest and the back, they can have it on the cheeks, they can have it on the forehead, and a lot of that will determine what it is that we decide to do for treatment. So I would just recommend if your teenager or your middle schooler does have acne, just to see your dermatologist and go over some options. And that doesn't mean that they're automatically going to recommend something like Accutane. There are lots of steps in between from simple over-the-counter treatments all the way up into Accutane that we can talk about. So your dermatologist is a great resource for that. The other thing that I oftentimes see in middle schoolers and high schoolers is warts. So again, like the molluscum contagiosum that we talked about with elementary school kids, this is caused by a virus. It's the human papillomavirus. So all warts are caused by human papillomavirus. And it tends to find places in the skin where there are little micro cuts or trauma, and it gets in there and it creates a home. So viruses have one job, and that one job is to survive. So as a dermatologist, what we're trying to do is to discourage the wart from living there. We get rid of its home, and we also invoke the immune system to come in and take care of it. And we can do that lots of different ways. And again, your dermatologist can go over those options with you. There are home treatments that you can try. The stronger ones work a little bit better, and consistency is key. But again, if you can't get rid of it yourself or you're having a hard time, you want to go a little bit faster or get some recommendations, I'd recommend seeing your dermatologist. Those are contagious. They can be spread on the same person. They can be spread from person to person. Kids tend to get them more than adults do. Of course, adults can also get them, but for some reason, they tend to be very common in kids, especially around middle school and high school. So again, lots of treatment options. See your dermatologist and they can come up with a plan. So let's talk a little bit about the fun stuff. That's the part of my talk where everybody's ears perk up a little bit, and it has to do with anti-aging, or at least aging gracefully. So I'm going to walk you through some of the things that we as dermatologists can do to turn back the hands of time, or at least kind of slow them down a little bit. I'm going to take a stepwise approach and kind of go from, the top half of the face to the bottom part of the face and then beyond, but we're mostly going to focus on the face. So let's start with the top part of the face. It's probably important to start off talking about the ways that our face ages. So what we've noticed, and I wish I could show you guys some pictures, but what we've noticed is that as people age, what part of their face kind of draws our attention tends to change. So when we're younger, what we tend to see is the eyes. And as we age, our focus kind of comes down to the lower part of the face. And so what we're doing when we're trying to rejuvenate people or make them look younger is to restore the focus back to the eyes so that our brains are telling us, okay, that person looks younger. So how do we do that? We could do that a few different ways. One of the ways is with Botox or with neurotoxin. So there are lots of different types of neurotoxin. There's Dysport and Xeomin, Jeuveau. But overall, there are a lot of similarities between those neurotoxins. There are some differences as well, but they're not huge, and you could talk to your dermatologist about that. Going forward, I'm going to refer to it as Botox just because that's the brand that everybody has pretty much heard of, and I'm going to use it in a generic sense. So with Botox, what we want to do is relax the muscles. And so we tend to find the places on the face that give us this nice refreshed look when we relax the muscles. So most commonly is the glabella, which is this area kind of between the eyes. And when we relax that area, we kind of lift the brows out and up. We also help to get rid of those 11s, those lines that are kind of in the middle of the glabella that start to age us after a while. When we've made this face over and over again because we're glaring at our kids or our spouses or whatever, it tends to start to etch in after a while. And so we can soften up that etching in by using Botox. When we can't make that face any longer, we can't keep etching in those lines. The other thing that a lot of people want us to treat is the horizontal lines on the forehead. And so we can do that again with some Botox. That muscle does tend to lift the brows a bit, so you don't want to overdo it because that can make your brows feel kind of heavy. And obviously that's not the look we're going for. We don't want someone to look more tired or more matte. We want them to look refreshed. And then probably the third most common area that people want me to treat is the crow's feet, which is the area kind of on the sides of the eyes there. So when you make a big crinkly smile, we can use some Botox so that you don't see those lines as well, and also so you don't continue to etch those in also. So doing all of those things will kind of give you a much more refreshed, youthful look. Of course, there are some other places that we can place it. It kind of depends on the person, but overall, that's kind of the general gist. Okay, so we talked about the upper part of the face, but what about the lower part of the face? Like I said before, we're wanting to kind of trick the eye into moving upwards towards the eyes on someone's face. So how do we do that? Well, we can use things that sort of replace the volume that we've lost. As we get older, we lose muscle, bone, and fat. And I think it may be one of the only times that most of us are upset to lose fat. But anyway, we want to use something to sort of replace those things artificially. And the most common thing that we use is hyaluronic acid. So our skin already has hyaluronic acid in it. So when we're injecting this, it's a little bit safer than say like collagen, which is what we used to use many, many years ago, because the body doesn't perceive it as being as foreign as say something like the collagen. So we already have it in our skin, we're replacing what's been lost, and we can find different areas that bother people the most. So some of the more common areas that people ask me to treat would be the marionette lines kind of under here, the nasolabial folds here, smile lines, under the eyes where the tear troughs are. And then another thing we can do is kind of give our skin and our face its scaffolding back. So again, as we age, we're losing volume, things are starting to elongate. Our philtrum elongates, our chin elongates, the sockets of our eyes start to get longer, our cheeks start to be less defined, our jaw starts to be less defined. So when we want to give ourselves some lift and we want to make this area look softer, we can actually do it by placing volume here. And we can use something called Voluma to do that. So that's kind of a thicker hyaluronic acid filler. There's also something called Lift that does something similar. So either of those are examples of things that we can use in this area. So watch as I give myself some lift here. It does tend to make my jowls here get a little less noticeable, and it gives us more definition in the cheeks. And so you sort of get two benefits from it. So that's another example of using fillers to give us back our volume that's maybe not even necessarily putting it right into the lines, but just giving us our structure back so that our faces start to look more like they did when we were younger. Another thing that you could use in addition to hyaluronic acid is something called Sculptra. So that tends to invoke the body to make collagen, and it's not immediate gratification, which makes it a little bit less popular with people, but I do always try to get people to pay attention to it. It works really nicely for my patients that have very thin faces. Maybe they're runners and they're always having a hard time keeping volume in the face, and they need an overall volumizing treatment rather than just filling in one space. That's a perfect treatment for it. It lasts a long time. Like I said, it does invoke collagen production, so it helps with the integrity of the skin as well. Just going back to the hyaluronic acid, one of the good things about that is it is reversible. We can use something called hyaluronidase to dissolve that if we run into any problems. So it is a very safe product to use. We can't really reverse Sculptra, but it works a little bit differently. So it's not really comparing apples to apples. So those are just a couple of things. There are lots of things that we can do and lots of different products that we can try. But those are just examples of things that you can do if you want to revolumize the face, give yourself some lift, get rid of some of those shadows that you're seeing when you're on your Zoom meetings or whatever it is, and just overall give some rejuvenation to the face. Of course, we can also do some things that are not really about rejuvenation, such as plumping the lips. Maybe you just want a bigger pout. We can use hyaluronic acid for that as well. So you can talk to your dermatologist about what products would be best for you. We have lots of things at our disposal now. And you guys can go over options in terms of where you might need some volume replaced and what type of product is going to work best. Lastly, let's talk about a few things other than filler and neurotoxins that you can use to rejuvenate. I'm not going to go into a whole lot of detail about these treatments because honestly, I could go on and on. So I'm just going to make some notable mentions and just understand that there are a whole lot of options out there that you can pursue. The first thing I want to talk about is microneedling, which I talked about a little bit earlier in the video, so I'm not going to go into a whole lot of detail. But again, that can be used for texture, it can be used for pores, it can be used for acne scarring, it can sometimes even be used for discoloration if used at the right setting. So that's something that you could pursue that has really low downtime. You don't have to take a lot of time off of work, it's not particularly painful, and you pretty much go back to normal after a few days. Something else would be lasers. There are so many types of lasers out there. Some of them are going to treat brown spots. Some of them are going to treat redness. Some of them are going to treat fine lines and wrinkles. And some of them can treat acne scarring and things where, there's even more remodeling of the collagen. So you can talk to your dermatologist about what sorts of lasers would fit with the things that you want to achieve. And that can be a very long conversation. So just go in prepared with questions. You can also do some things to kind of help with contouring. So something like Kybella. So that is an injectable that we put under the chin to get rid of that double chin, that turkey neck, so to speak. It's not really going to tighten the skin, but it can get rid of the fullness that you have in the submental area. Another thing would be like Ultherapy or Thermage, and both of those things use like ultrasound and radio frequency respectively to tighten the skin, and that gives you a lot of tightening in the neck area, along the jawline, in the cheeks, and just about anywhere else that you want to have that done. One of the newer kids on the block that's really, really growing in popularity with dermatology is radiofrequency microneedling. So that would be something like Profound, and we can use that for cellulite. We can use that again for tightening around the face and tightening around the neck. It has a whole lot of uses. But the main point is your options are endless. Go out there, talk to your dermatologist, find out what it is that you have at your disposal to treat the things that you want to improve so that you can gain your confidence, you can feel younger, get that mommy makeover that isn't the mommy makeover that involves surgery. Go in and do some things to really make yourself feel good. And your dermatologist can help you do that. So feel free to come in and ask us any questions that you might have. And thanks so much for listening to our talk today.
Everyone get their comments in. I'm pretty sure most everyone had already kind of done that. Next up, you do not want to miss our next presenter. It's Tanya Knudsen. She's the lactation consultant, and you will learn things that you didn't even know you didn't know. I feel like I learn something every single time that I listen to her talk. She's been speaking with us for quite some time. So with that being said, we will see you over at Tanya's webinar here in a couple of minutes. Thank you so much for joining.